Hi, it's Dr. Matt Harkness from Allied Physical Therapy, where our mission is to get you back to what you love without surgery and without medication. So today I'm going to talk about reducing pain at the neck and the jaw. I am a cranial-facial specialist, so I spend the bulk of my time treating these types of injuries. So let's take a look at the anatomy, and then we will look at a few exercises, and it will be fun. Okay, a little review of the anatomy of the temporomandibular joint here. And remember that this joint is very active. Between talking and chewing, this joint perhaps is arguably the most used joint in the body. So what happens when you have pain? These muscles all around this joint, they tighten up real tight, and they go into kind of like a spasm, and you have limited opening of the jaw. So just a quick review of the mechanics. When you open the jaw, this joint here kind of rotates, and then as you open wider, the joint translates forward. And so there's rotation and translation. So we want to do an exercise that just is in the rotation component of the jaw. Okay, the first exercise we're going to show you is what's called control mouth opening. And this exercise is to help to make sure the jaw, the temporomandibular joint, is opening nice and easily, allowing for the muscles to relax and good lubrication around the joint. Now remember, I talked about there are two motions to the TMJ joint. There's rotation and then there's forward translation. So this exercise is just rotation. So in the no position, and then open your mouth and close it. So we'll have Jimmy show us. Open, yep. Tongue is in that no position just behind the front teeth at the roof of the mouth, and do about 3 to 6 times. Okay, so let's take a look at this model. Here we have the upper cervical spine, and this is the base of the skull here. And there are several muscles, tiny muscles, that attach from the cervical spine to the base of the skull. This is kind of like ground zero for headaches. So what happens if these muscles are tight and they're contracted, it pulls the head back and you get what's called a forward head posture. Your chin is sticking out, and it compresses the nerves, which can cause headaches. And also those muscles in a sustained contraction really cause a lot of tension and feeling of headaches at the base of the skull. So what we want to do is make sure that we have adequate space between each vertebrae and at the base of the skull. Then you will be comfortable, pain-free, and be able to function well. Okay, the next exercise is called the double chin, and this is to help relieve the tension and the compression at the back of the neck that we just saw in the video of the anatomical model. So what you're going to do, so Jimmy, if you can just demonstrate, you're going to just do a double chin, hold about 3 seconds, and relax, yeah? So he's not really lifting his head off the pillow, he's just doing a double chin. One more time. Okay, there are two exercises, the controlled mouth opening and the double chin, which will help to alleviate headaches, allow for nice function of the jaw. And I like to do these if you're a dentist, if you are doing some work, root canal, or doing a filling, and take a break and just say, let's do 2 double chins, 2 open and close in the no position, and then continue with the procedure. But I like to do that every probably 3 minutes, 5 minutes tops, just to make sure the joint doesn't get injured during a dental procedure. Now, of course, if you are not a dentist, I do recommend you do these at home. You can do them in the car, you can do them in the morning before you get up, and it will help to relieve headaches and pain. Now, if you try these consistently for about 2 weeks and you're still having pain, it's a great time to pick up the phone and give us a call. Or go to our website, alliedpt.com, and you can set up an appointment. And also remember, you can download information here. Let's see, we've got a couple of our ebooks. This is the one that has all this information on it on our website, Stop Neck and Jaw Pain. Be sure to look at some of our testimonials online, and we look forward to getting you back to what you love, and we'll see you next week.